Move on to the next presentation, please. Last presentation. So premium IOLs with the retinal problem. So how do we deal with these kind of things? So that's the important question which needs to be addressed. We all know that multifocal IOLs are often discouraged in patients with or at risk of retinal disorders. So there's something called as the use of dark adaptation to screen before the multifocal IOL implantation, and identifying patients with early AMD is necessary definitely to avoid suboptimal surgical outcomes. This was something which was reported 2014, that the ADAPT DX dark adaptometer, it works by measuring a patient's rod intercept time, that is the number of minutes it takes for the eye to adapt from bright light to the darkness. So looking at the cost effectiveness of preoperative OCT in cataract evaluation for multifocal IOL, the study says that a preoperative screening OCT during evaluation of patient considering a multifocal IOL added to the cost of the cataract surgery, but the OCT increased the detection of macular pathologies and also improved the QALYs over the time. So let us look at the three scenarios. One, 61-year-old software engineer, bilateral drusenoid PED, right eye multifocal IOL. So how to choose and what to choose? There is plethora of IOLs already available in the market for the other eye. So there is definitely the category and the perspective, especially the patients with early maculopathy with pigmentary changes are difficult counseling. However, patients with moderate to severe AMD, there is presence of drusen, geographical atrophy or exudative changes. They are definitely no for multifocal IOL, but definitely yes for monofocal or toric IOLs can benefit from these kind of situations. Now, looking at the pros and the cons, let's look at the cons. Reduced contrast sensitivity, night vision issues, but what are the pros? More freedom, reduced lifetime cost of glasses and contacts, provide better visual experience for the patient. Now, the scenario asked, would you implant a multifocal IOL in a patient with age-related macular degeneration? Few of the authors have described that they are no longer able to drive or engage in activities they love doing. Several articles have listed depression as something not uncommon among the patients with AMD having multifocal IOL. Now, let's look at this slide. Why am I putting this, what is the lifespan of the people in India? Say around 69 or 70 years. Now, look at the demographics of wet AMD. When does it happen? Up to 75 to 80, it is reported as 2.2%, and more than 80, it is 8.2. Let's look at the demographic of geographical atrophy. 75 to 80 is just 1.8. More than 80 is 7%. So the debate always arises here is, why should we not implant a multifocal IOL? So there are several short-term outcomes in combined pars-plana vitrectomy, epiretinal membrane, which have shown that multifocality was achieved, but final visual outcome was delayed because of PCO and macular healing. Let's look at the another scenario, wet AMD or geographical atrophy. Not to worry at all, because we have a plethora of injections already available in the market. Home OCT is now come into the thing, which is the artificial intelligence, that is the Nota Vision, which is also very good, detecting, very nice. Now the last scenario is needing surgical intervention, that is the bleed at the macula. The diffractive multifocal IOL various has been described ghost image, arc shape image, wave shape image, and most of these things. And in these, yes sir.
So the General Body Meeting of 2025 All India Ophthalmological Society is called to order. Because of lack of quorum, we will adjourn and reassemble in 4:30.
Okay, so I'll take just one more minute. Here you can see the surgical scenarios in case of a multifocal IOL. So here, see here, now let us look at this, the case of retinal detachment with the PVR. Now you can see a very bad membranes with a subretinal gliotic. Usually in case of the wide angle viewing, it doesn't cause much of difference at all. Now you can see I'm removing these subretinal gliotic blands even in cases of the multifocal IOLs. I don't see much of problem in these kind of cases. Now let's look into the macular pathologies. So this is again a multifocal IOL. You can see here. Now after doing PVD induction, so when we put the flat lens, now you can see here, sometimes you can see that blurring. Now you see the blurring is there at the instrument, but what you see at the membrane is very clear. Sometimes the membrane is clear, So these kind of things will definitely has to be there, but definitely with the use of the filters, now you can see I'm using it with the monochrome, definitely you can peel this without much of a problem, but definitely it will be a little bit of problem. So some people have, authors have said that you can coat it with a viscoat on the anterior and the posterior surface of these multifocal IOL so that you don't get these ghost kind of images. So lastly, I would like to say, whether multifocal intraocular lenses and retinal disease, there's a very beautiful paper by Andrew Gribowski. We were unable to find evidence suggesting that patients with macular disease should be advised against multifocal IOL. Several contraindications for MIOLs in the patients with diseases have a hypothetical character and are not evidence-based. So more research is needed, especially to address the effect of multifocal IOLs. So by this, I would like to end this talk. Thank you very much, and thank you, expert panel. I thank all the speakers who have been kind enough, and due to a little paucity of time, because we are having a general body meeting here, I also thank the keynote speaker and rest of the speakers for their wonderful deliberations. Thank you, delegates. Thank you.